Hi, my name is Adrian. I'm the Director of Adult Social Services for Bury Council, which is one of the councils in partnership with the Northern Care Alliance. And I've been asked to share with you some of the impacts that I'm beginning to see since we became part of the Frontrunner programme. Prior to being in the programme, after a number of years of discharge to assess as a policy, we'd seen real growth in the number of people receiving adult social care. If I take, for example, the number of home care users over a 3-year period, I'd seen a 35% increase in the numbers of users getting care at home every single day. And if I look at our care home use, regularly I'd have 10% of our care home beds available and for people who needed them, and more recently that's been lower than 1%. So you can imagine the lack of choice and how long it takes to find a suitable care home bed, despite the pressures that it's been putting on adult social care budgets. And this was the case even after stimulating the market with quite large fee rises. We were just getting to the point where we're simply just running out of capacity. So since starting on the programme, we have seen the number of P3 discharges begin to drop, and now I'm actually up to 3% of my care home beds vacant, which is great. It's more choice for people, but also most importantly, it takes fewer days to find a suitable care home. If I look at our home care use, I'm pleased to say it's finally stopped increasing. We first saw a reduction in the rate of increase, then we saw a plateau, and this last month we've seen a small drop. So quite a long way to go to get back to the position we were over 3 years ago, but real progress there with demand reducing. Because what that means is when you have more care available, it's easier to arrange, more timely to arrange, and therefore the number of days that people wait for that service to start has considerably dropped. And we are seeing that in the numbers on the no right to reside list have been dropping, but I think most importantly the length of stay dropping. So it's the days that they stay on that no right to reside list have dropped, but equally we're seeing with drops in the 21, 14 and 7 days length of stay in the local hospital, which is great. And I can probably explain some of that by using an example of the council's reablement service. So prior to being in the programme, every single package of care was 4 calls a day. And it takes quite a long time to arrange 4 calls a day and all those different runs and all those different rotas. And I'm pleased to say now that not everybody's asking for 4 calls a day. We've actually seen the time that people have to wait for our reablement service to get all those calls has dropped in half, which is just super. We're also able to get more people on the service, so the numbers getting reablement has increased by 22%, which is just superb. So it's early days yet, but we're obviously seeing some reductions in demand at the point of discharge, which is freeing up capacity in the community, which as a result is meaning that people have to wait far, fewer days really to get the care that they need. So overall, some really, really great progress. Thanks.